All right, guys, so I had a question in the total knee replacement support group about wedges, and specifically like post-surgical wedges. What kind of wedge should I get? So I was just going to talk about the two most common scenarios. So this is the wedge that has the flat platform and the slope toward the front. This would normally be positioned just like that, with the individual head that way, feet coming up here, feet resting up here. The other wedge, probably the more common wedge, is just a straight triangle, right? And so pros and cons. The triangle, usually what I try to do is I say, try to get it long enough so that this is coming in under the hip, close to the top of the upper leg. You want as much contact, as much support through this as possible. I usually try to get at least 12 inches of height on this end, and I usually try to position patients so their heel is hanging off this part. Now, what's nice about these wedges, they're versatile. Like, you're not just going to use it for the knee replacement. You can use it for stuff into the future. But the reality is, for most of my clients, especially ones that have low back pain, these wedges with the flat top are more comfortable. So depending on why you're choosing a wedge, what you're using it for, if you're using the wedge simply to elevate the leg, it doesn't matter too much whether it's a straight wedge or a wedge that goes up and has a flat platform. If you're using it to improve extension throughout the night, range of motion, then you want just the straight triangle wedge with the flat surface. But if you're making extension gains, and you're not going to know this until after surgery, but if you're improving your range of motion, if you're working on it throughout the day, you really can just save the night to get good quality sleep. Nothing is going to beat good quality sleep. So whatever position you need to get into to get a good night's sleep, do it. The last thing that I would talk about here, depending on the material, so you're going to be coming out of the hospital, you're going to be uncomfortable. You want something that's kind of a lightweight, breathable material. I like some sort of cotton fiber surface, like something like this. This is a polyester. It just doesn't do well with sweat and moisture and things like that. These will all have some sort of removable covering that you can wash. Super important. They do sell vinyl wedges that you can wipe down, but again, it just gets hot and sweaty and uncomfortable. So think about the shape, think about the height, the depth. You want it to match your body. If you're 4'8" or if you're 6'2", you probably need a different size wedge. So think about those factors, and then think about the material that's covering the wedge. I will put links in the bottom YouTube description of this video to Amazon showing you a couple different options. Guys, thanks for asking questions. Keep them coming. I'll see you on the next video.